Hello, all. I'm Candace Floyd, and this is my anemia case study. Today, we're going to talk about a 42-year-old Hispanic woman who has come into the ER with the chief complaints of fatigue and dizziness for the past 2 weeks. And she fell the day before. Her height, 5'6", or 143 centimeters, 99 pounds, 45 kilograms, 22 BMI. Vitals, 97 degrees, blood pressure 107 over 48. The diastolic, or the bottom number, was a little low. It's supposed to be at least 60. Mean arterial pressure, heart rate, respiratory rate, and oxygen saturation were all okay. During the physical exam, there was noted pallor, pale mucous membranes, pale conjunctiva in the eyes, no palpable lymphadenopathy, no bleeding, pelvic exam decline, no labored breathing, mild heart murmur, grade 2 systolic flow, no abdominal masses were felt. She is considered thin, but strong arms, upper and lower arms. Her extremities are strong. When the hands were examined, there was noted colonychia present in the fingernails. General medical history: since age 10, she's had heavy periods, irregular periods, 2 to 3 weeks, heavy flow, along with blood clots. And then at age 30, excessively heavy menstruation, bleeding between cycles up to 15 days. Recently, about 2 weeks ago, she was in a wheelchair because of the dizziness and fatigue. Besides the menorrhagia or irregular heavy menstrual periods, overall family and personal medical history was uneventful. Unconfirmed history of pregnancy, transfusion, IV drug use, or immunoglobulin via IV. There was also blood labs done, and the mean corpuscular value was low. It was 50, should have been 82. Hemoglobin was low. Red blood cells or erythrocytes were low. Hematocrit low. RDW, or red distribution width, meaning that there was different sizes of red blood cells. Serum iron low, 9, should have been 38. Iron saturation 2%, should have been 15. Ferritin 4 nanograms, should have been at least 12. And the ferritin is the stored iron, so that means she's really depleted. The other labs that were taken: water-soluble vitamins like B12, folate. The hemolysis labs were fine, nothing remarkable there. Lactate dehydrogenase was good. Haptoglobin, bilirubin direct. You would have seen that with what they call hemolytic anemia. The only thing that was a little high was prothrombin time, which is 17 points. So at 17.6 seconds, should have been at least 11 to 14. That is the time that the blood is taken to clot. There was a peripheral smear done, which showed signs of anocytosis, which is indirect proof with the RDW, which just talks about different sizes of red blood cells. And we also have microcytic or hyperchromic, meaning they're small and pale. So she's pale, blood's pale, a lot going on. So these are all anemias based on low iron. Diagnosis that was also done: CT scan, contrast, abdomen, pelvis, 3.5 centimeter mass with within endometrium, possibly intracavitary submucosal uh, leiomyoma. The PES statement, or the PES, excuse me, inadequate iron intake as related to pallor and pale conjunctiva as evidenced by low to extremely low MCV, hemoglobin, hematocrit, iron, and iron saturation. Fatigue and colonychia are related to depleted iron stores as evidenced by serum ferritin levels. Increased iron needs related to menorrhagia, evidenced by a diagnosis of hyperchromic and microcytic anemia. So upon conclusion of her hospital visit, the dizziness and fatigue was caused by chronic, not an acute issue, chronic, as we can see that, she's been having heavy bleeding since age 10 and she's now 42. So that is very chronic. They also thought about cardio issues, cardiopulmonary issues, metabolic, endocrine, but what really stood out was the blood-related labs, which confirmed a hematological condition. They treated her 4 days. She stayed in the hospital 4 days, 5 units of packed red blood cells, 2 grams IV iron, dextrin, 150 milligrams of medroxyprogesterone via intramuscular injection. Upon discharge, she was overall back to normal, being much higher with 8.1 hemoglobin, hematocrit 24.3. And then the other type of anemia that it could have possibly been if those labs had been correct, not correct, but if those labs had been appropriate, would be the hemolytic anemia, which is an inherited disease that attacks and destroys red blood cells. Those labs that would have been off would the hemoglobin, reticulocyte count, total bilirubin, lactate dehydrogenase, and haptoglobin. The only one that was low was the hemoglobin. The symptoms of this is internal bleeding, jaundice, possible brain damage. The treatment, immunosuppressants to calm the immune system, immunodilators to regulate, alkylating agents. The only nutritional thing that really can be done is folate and physically avoiding cold to help the symptoms and help this disease. Those are my references. Thank you.